Hello, everyone. Thank you for joining us today for our monthly Strengthening Families Networking webinar. Today, we're focusing on legal partnering for child and family health. I'm very excited to welcome our guest presenters. We'll get started with some general housekeeping and updates first. And you may see that you can already see the webcam of Samantha Morton, who's one of our presenters today. So friendly face there as we get into our webinar. And I will note this webinar is being recorded, and you also can right now go to the Handouts tab and download a PDF of the slides. So if you are interested in sharing those with others, or just if you like to follow along on your own, you can download that, print it, and you can also you can also access those resources afterwards when they're posted at the site that you can see linked here on this slide. So we do these webinars once a month, and each month we have a different topic with a guest speaker. It's always open to anyone who would like to attend, to folks who are implementing Strengthening Families at a program level, coordinating Strengthening Families efforts for their state or community. However you are interested in strengthening families or any given topic, you are welcome to join us and invite others to join us. We jointly convene these between the Center for the Study of Social Policy and our partners at the Children's Trust Fund Alliance. And the Children's Trust Fund Alliance posts the recordings and materials each month on the site that you see there. That will always be in the follow-up email, in our newsletters, and other places so that you can, if you missed a month, you can click on that and get to right where the recording and handouts will be. You can also just peruse through there. There are years now of these webinars on really interesting topics related to strengthening families implementation. So if you've got some free time, go ahead and browse through those. Okay. So as I said, we do these each month. It's always on the second Thursday at this time. And in April, we'll be hearing about a new curriculum for family-serving professionals called Flourishing Families that was developed in Arizona. And our Strengthening Families partners there in Arizona will share that. You can register now for that. You will note that registration link is for a Zoom webinar. We are switching over to Zoom. April will be our first time making that switch. We've gotten pretty fluent with the bells and whistles here in GoToWebinar. I'm sure we'll get fluent in Zoom, but it may take a little period of adjustment. So bear with us as we switch over to Zoom for next month. Hopefully it won't have much of an impact on your experience as a participant. And then you can just mark the second Thursday of each month at this time of day, whatever time it is where you are right now. That will be May 14th, June 11th, July 9th. We will announce those topics as they come up. And each month we announce those in a newsletter that goes out. If you don't currently get that, you can go to cssp.org and sign up to receive our Strengthening Families newsletter or any other newsletter that you would like. We also post the webinar information on our events page. The Alliance posted on that Google site. So you can find that information. You've got the place held on your calendar. You can always find what the topic is as it gets closer and register if you're interested. So for today, I'm going to share a couple quick updates on Strengthening Families related work from CSSP. We actually don't have updates from the Alliance as we often do. So then we'll jump right into legal partnering for child and family health with our guest presenters. All right, a couple of updates from me to start. I'm not live on camera, but there's a picture of me. We have a survey out right now about community conditions and how folks are using a protective factors approach in community level work, whether that's focused on promoting child and family well-being or preventing child abuse and neglect or some combination thereof. We want to hear about what you're doing. We want to know what frameworks or resources you're using. If you are using Strengthening Families in that or connecting it to your Strengthening Families work, we want to hear about that. Basically, we're trying to get the lay of the land. We will be and by we, I mean a small group that's been working on this from within our Strengthening Families National Network of folks who are implementing at the local level and are interested in thinking about what protective factors might look like in terms of community conditions that promote thriving, but also in how folks are using our existing family protective factors to do work at the community level. So that survey is live. It is scheduled to close tomorrow, so please respond today or tomorrow. We may extend that depending on if you let us know that you still want to respond and aren't going to have a chance we can leave it open a bit longer, but the plan is to close it tomorrow. So please respond and share it with others in your state and tell us what you know. All right, also exciting news coming up in October is the Together for Families Conference. This will be the second time that we've done this conference, co-hosted this year by the National Family Support Network, the Center for the Study of Social Policy, Be Strong Families, the City of Seattle Human Services Department, and Families Canada. So it's an international conference for the first time, and being in Seattle, Canadian partners are able to come pretty easily. So we're really looking forward to that in October, and right now, the call for proposals is open. So if you would like to share some of your work, you can submit a proposal at the SurveyMonkey link that you see. You can also right now go to the handouts panel and download a Word version of that call for proposals. You need to submit it on SurveyMonkey, but we know that sometimes it's useful to have a Word version if you're preparing your proposal, working with a collaborator, and want to send it back and forth and not just use that SurveyMonkey screen. So the Word document is there as a handout. You can access it from the SurveyMonkey page as well. These will be 75-minute sessions, and we have 4 conference tracks. So when you put your proposal in, you'll have to indicate one of these tracks that it relates the most to. We have a track about advancing equity for families, one about implementing the standards of quality for family strengthening and support, one about using strengthening families, the framework and approach, and one about enhancing family support practice more generally. So you'll see we've got the standards of quality and the strengthening families ones are going to be specific to people who are talking about those specific tools and frameworks. And the equity one, we really hope to get a wide array of conversations going about how people are advancing equity in their work with families, whether that's racial equity, gender, sexuality, socioeconomic, all forms of equity. We really want to just keep that conversation going that we know has been getting started in a lot of places, and make sure that we're bringing everyone together to hear about innovative ways people are taking that on in their communities. And then the one about enhancing family support practice, we're hoping to hear a lot about things like engaging fathers, working with families in specific circumstances or with, with certain special needs, whatever that might be. If it's not about protective factors exactly, and it's not about implementing standards of quality, we still want to hear about it in that general family support track. And the deadline for those proposals is April 13th. We've got about a month to put your thinking cap on, reach out to other partners that you might want to co-present with, reach out to one of us on the planning committee if you are not sure if you should submit, and I think the answer will always be yes, but you can still reach out and ask because we want to hear what you've got to say. We have committees for each of these tracks that will be making some selections and getting back to you so that you can make your conference plan. Finally, I've said this on a couple of recent webinars, and I left it in here to keep myself honest, that I will be reaching out soon to get updates to information from all of these states that are colored in dark blue on our map. You are a state that is considered a member of the Strengthening Families National Network, and we're updating all our information about who is in the network and what they're doing. So if you're in a state that's dark blue and you're a state lead, you'll be hearing from me. If you're in a state that is light blue, that means that we think we know there's Strengthening Families activity going on, but your state is not a member of our network. If you would like to join the network, let me know. If you're a white state, a state that's colored white on this map, and you would think that's wrong and you would rather join the network, or at least let me know there is statewide work going on, please let me know that. We want to update all of this so that we have an accurate picture of who's doing what and exactly how strong our network is. We know that you're all out there all over the country, but we want to make sure that we can tell a clear and accurate story of who's doing what. So please stay in touch and keep an eye out for emails from me. All right, with that, I'm going to hand over to our guest presenters today. Stephanie Doyle is a senior associate at CSSP, one of my colleagues, and Samantha Morton is the CEO of MLPB in Boston. And the two of them are going to be talking about a paper they wrote and great work they've been doing about legal partnering for child and family health. So with that, I'm going to hand it off to you two.
Great, thank you, Kaylin. And I'm going to get us started and then really pass this along to Samantha to talk through a lot about what she is learning through her work, and that we've had a great opportunity to learn with her in our work at CSSP. So to the next slide. So this work, this webinar really is based off a paper that Samantha was the lead author on, that we partnered with her at CSSP, called Legal Partnering for Child and Family Health. It's available on CSSP's website. Over the last several years, CSSP has had the great opportunity to partner with Samantha and her team at MLPB in our work on the DULCE model. And while that was really started as a specific pediatric intervention, it has allowed us to learn and really think about the ways in which legal partnering can really be supportive of creating equitable opportunities and access for families in early childhood systems across the board. And have had the great pleasure of thinking sort of really big picture with her on that, and learning so much from that work and the work she's doing in Massachusetts. So we're excited to continue that partnership and learn from her. Next slide. So really this work, the DULCE model and the work that we're talking about here really was born out of the Strengthening Families initiative. The Strengthening Families approach really focused in on that protective factor around concrete supports in times of need. Next slide. And one of the things sorry, if you can go back one. One of the things that's really recognizes here that a key part of our work is really to work with families around ensuring their access to those concrete supports. But I'm sure many folks on the phone and our partners in our communities recognize that we are often up against different barriers to access for families. Things that might exist bureaucratically, policy-wise, a whole host of access issues for families as they're trying to get their concrete supports met. Next slide. And those things range across the board. We know the experience and the disparate impact of poverty among children in families of color, that we have been really experiencing, particularly lately, federal laws and policies increasingly marginalizing immigrant families and creating barriers for families to meet their basic needs. That those sort of bureaucratic mechanisms such as work requirements and re-enrollment periods, things of that nature, can really make it difficult at the state and local level to access consistently to get your needs met. And that over time, this has really resulted in a widening racial wealth gap among families. And that in addition, we're seeing the historical nature of how families of color have been impacted by family separation policies. So really thinking about concrete supports in terms of safety as well as for families, their ability to be together and to access safe communities and safe relationships. Next slide. So as we were thinking about this and thinking about how does, in our work with DULCE and other areas, how sort of that access really is an adverse childhood experience for children and families, and how making sure that families have that access to those basic concrete supports is really critical to supporting their healthy development. And that we really have to be thinking about what are all the ways that we can do that, because in many cases, while we might be able to build those partnerships or provide those referrals, there are still these systemic and policy barriers for young children. And what we have learned through our partnership with MLPB and what they are actively doing, implementing, and advocating for, both locally and across the country, is thinking about how legal partners can sort of join us in the early childhood system to be able to address those barriers and really think both at the individual level with families, but also sort of systemically as how we reduce barriers for families to access those needs so that they might have what they need in support of their child thriving. And so with that, I'm going to pass this over to Samantha to continue this conversation about what that might look like for early childhood systems.
Thank you, Stephanie. Thank you, Kaylin, and thank you, Strengthening Families colleagues. Stephanie, you were too generous. What a thought partner you are and remain in this work around legal partnering. Thank you for being my teacher on so much. And It's really a pleasure to be here with all of you in this setting. Lovely to be on a virtual in a virtual setting that was always intended to be a virtual setting, and very excited to tell you a lot more about our work. But let's actually dive into a really concrete example by focusing in on a family, and I think that will help us frame our conversation, which I know Stephanie and I both are really looking forward to being a true conversation and dialogue. So let's pause for a second and just consider the case of Myrna. Myrna, a single mom of 2 kids, age 3 and 6 months. The 3-year-old has a diagnosis of sickle cell disease, which we know is quite profound. Myrna migrated from the Dominican Republic as a child. She works 2 jobs to make ends meet and taps friends and family for childcare, and that is sometimes unreliable and definitely stressful. She's staying with her brother's family right now and doesn't always feel welcome. She wants to get her family their own place. When she goes to see places, very frequently the landlord says, it's already rented or I decided to sell. So I'm wondering, in this group of about 30 Strengthening Families leaders, who has any ideas about legal risks, rights, or remedies that Myrna might be facing?
And this is Kaylin. I will say you can type your thought into the chat box or the question box, and we will read it aloud. Or if you're in a place where you can unmute yourself, you can raise your hand, and then we can unmute you so that you can speak. So I see that Katie Haberman just wrote in fair housing rights violation.
Yes, thank you, Katie. Fair housing, by the way, is a term of art in law and policy that not everybody knows. So it's really exciting that you started us there, that if Myrna is going from advertised rental property to rental property and being repeatedly told, despite what she saw online or in the paper or in the window, it's already rented, I decided to sell. Gee, that sounds an awful lot like what professional fair housing testers would identify as a pattern and practice of discrimination, potentially based on any number of protected categories, including race. So thank you, Katie. Incidentally, I just want to be clear, I, as a panelist, I can't see what's happening in the chat box, which may be appropriate, but I'll stop now in case there's other chats that Kaylin can convey.
I am going to make you and Stephanie both what's called an organizer so that you can see those chats. I'll still read them aloud for you if we get too many coming in, but yes, I have not given you that access. So far, nobody else has typed in. Okay, well, I got to say that the first one was definitely a headline. I wonder if anybody else is noticing anything else in there that might pose a risk to the health and safety of Myrna's family. Maybe we focus on health and safety first, and then we go to legal risks, rights, and remedies. So Katie, as well as Becky Mather, have both typed in now immigration status question that could be at play.
Absolutely, and this could be in play. This can be in play in a number of ways, including, and I also want to invite Stephanie to comment on this as well as any other part of our conversation today. We know that a housing budget can't be disconnected from a food budget, an energy budget, a life budget, a clothes for school budget. And so how Myrna and her family are thinking about, how she's thinking about, can I get off my brother's couch and pursue this kind of housing that I want for my family, really hinges in no small part on immigration status, which is one of 2 core eligibility criteria alongside income for a range of supports that, cash and otherwise, that might make it possible for Myrna to cover all her family's monthly expenses. So great issue spotting. Kaylin, unless we have other thoughts, I say let's, Stephanie, were you going to say something?
I was just going to raise up sickle cell disease being a particular special healthcare condition for a young child that might result in protections.
You bet. Thank you. And that's specifically something that might trigger, depending on the state that Myrna is in. She was in Massachusetts or most other states. It might protect her family from utility shutoff in ways that would threaten that child's health by virtue of cold being so closely associated with the sickle cell episode, which can be life-threatening. So there's actually a lot buried in here, and we're gonna even take it, we're gonna keep moving, but thank you already for those 3 huge issues that have been spotted. Let's go to the next slide, Kaylin. Okay, so Myrna's finally able to rent an apartment. She's been warned by several friends that the new landlord can be tricky. She hears from the county she lives in that her kids, both of whom were born here, their SNAP benefits are being terminated. She knows she is not going to be able to pay next month's bills. And finally, after moving in, Myrna notices that the windows are so drafty that things are always cold. And now this goes back to Stephanie's point about the connection of having a child with special health care needs. And she can't, it's unaffordable to run the heat high. When she raises this with her landlord, he says something pretty alienating, if not threatening. He's going to threaten, he threatens to call ICE. And if ICE isn't a familiar acronym, ICE stands for Immigration and Customs Enforcement. So, and everyone's allowed to double back to earlier observations. What else do you spot here? And Kaylin, no problem. I might not have followed you before. I can't see what's happening in the chat, which is actually sort of exciting. But I will. I am totally excited to have things conveyed. I mean, just to start us off, since immigration status was raised, we see a landlord getting ready to exploit that vulnerability for a mom with 2 young children in a very, very serious way, and a way where even though in the state Myrna lives, she likely has enforceable rights with respect to poor housing conditions and sanitary code enforcement. She may decide, even if she's lucky enough to speak with a lawyer about those rights, that there's no guarantee that the landlord won't drop a dime on her if she does that, because the housing authorities aren't going to be able to protect her from that. So there's some pretty, significant trade-offs in her life that Myrna has to navigate as an immigrant mom. I'll pause there in case there are chats coming in.
Yes, Katie did type in again, legal support for benefits for SNAP and disability.
Fabulous. That's exactly why we're here, because she may have rights. She may have rights that were violated, if not trampled, when these SNAP benefits were terminated in surprising ways. Sometimes it's egregious, and sometimes it's a miscalculation of income on the part of the administering agency. But either way, the outcome or the impact for the family is the same. I'll toss it back to you, Kaylin.
Not seeing anything else typed in right now, so just a reminder to folks, no wrong answers. Feel free to type in anything that comes to mind, and also feel free to raise your hand if you'd like to speak. I can unmute you.
Great. So just to punctuate here, Myrna actually has rights, particularly to not just fair housing, but healthy housing for her and her kids, who include a child with special health care needs. We'll talk in a few minutes about Myrna's ability to access a lawyer if she needs it or wants it for benefits troubleshooting and housing, healthy housing and fair housing access. But we know these are very common challenges facing families that you and your organization serve. Let's go to the next slide. So on the topic of someone's last chat, which was she needs legal support, when families present with these kinds of challenges in your community, can folks chat in, and this is, again, example of really there's no possible wrong answer here, how you go about or how your colleagues go about trying to connect them to resources, and how successful is that? And I mean specifically legal resources.
And while we wait for folks to chat in, I will just point out, those of you who call into these webinars regularly, you might be used to there being a lot of other people commenting, but we have a lower number of participants today, I think because everyone is regrouping and has kids home from school and all other things. So we're counting on all of you to jump into the conversation and tell us what you're thinking. So we did get a message typed in from Christina Palkington, who says Migrant Legal Aid is a place I would prefer.
Great. Since you spoke up, are you able, does every family you send there get the service they need? And I don't mean this in a sort of asking a question about performance or quality by the agency that you reference. I'm sure they do great work, but is it a bottomless pit of legal aids, of legal services for families in need in your community? Because that's exciting if that's true.
Christina writes, we haven't had that be the case.
It's not a bottomless pit.
Right. We also see a couple, Christina adds, resources have been very limited.
Right.
And we also have another comment from Katie Haberman, who says referral to legal aid services, whoever receives LSC funds in the state.
Okay, Katie, we definitely have to connect after this webinar, because I think you may be able to navigate some professional opportunities across sectors, is all I'm going to say. We'll leave it there. But you have invoked another really important term, LSC, which is Legal Services Corporation, which is a quasi federal agency based in Washington, D.C. that is the single largest funding source for regional legal services throughout the United States. So, Katie, your familiarity with that is exciting. And I wonder if anybody knows, Katie or otherwise, what strings are attached to receiving LSC funding. Does anybody know who legal aid can't serve if they take legal LSC funding? This is if we were on Jeopardy, this would definitely be a final Jeopardy question.
Christina writes with a question mark, undocumented?
Christina, okay, now it's going to be a three-way follow-up after this, Katie and me and Stephanie, four-way. All right, ding, 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 you got it. So if you're undocumented, barring a very small slice of immigration status applications you might be in the midst of, which might be humanitarian and therefore get you out of the ineligible zone, most LSC funded legal aid organizations are actually prohibited from serving undocumented people. Since I know we are on the line as a community of learners today from across the country with serving families with different demographics, but also families in a country that is continuing to be enriched by more and more immigrants. I just want to, really punctuate what a big deal that is in terms of understanding the landscape of scarce legal resources. Once we sort of figure out what that landscape is, we then have to continue subtracting access because of constraints like that. Okay, next slide, Kaylin.
Actually, we've got a couple other comments I want to make sure that we get to share. So Katie did add, can't represent folks who do not have particular recognized status, but can represent children of those folks if they do have status. And Katie also added, but can usually represent undocumented folks applying for a U visa.
Exactly.
And then, then we have two other folks who have weighed in. Christina Pocklington added, there is the Healthy Homes Coalition that could connect others to lawyers, but I'm not sure. And then I actually received a comment by email. This might be someone who's just participating by phone and couldn't type in to go to webinar. So Betsy Dobbins says, our community relies on 2 legal services providers. Challenge for families to complete intake and provide all documentation. It often becomes another hurdle. Often the legal services provides only self-help or pro bono connection. LSC funds have a lot of restrictions. My organization receives direct referrals for kids and juvenile justice. Because we're not LSD funded, we can dynamically and quickly respond to need, but only have an advocacy capacity for education.
Okay, next time we have to do this in person. I don't care where we are in this public health crisis nationally, but I've got to meet all of you who are chatting in. Thank you so much for that great chat that you just shared, and the example that you gave of not being LSC funded, but actually then being both an asset and limited in other ways by virtue of which area of law can you support families in, right? Thank goodness your community has access to educational lawyers who are specialized in educational access. And we know that families' lives are complicated and barriers to concrete support are complicated, and often people present with no less than 3 legal needs at once, which very few of us would actually recognize as legal needs. We might recognize them as a status challenge or a landlord problem, or frankly, we're skipping too many meals each week. But behind that framework of barriers to concrete supports, that concrete supports is such a tangible phrase that I've only been familiar with for 10 years, but behind that, there's this invisible framework of laws and policies that actually should become more visible in our work together, so that we can help more folks access the supports they want and need in line with their rights. Kaylin, I want to see if there's any more chats before we keep going.
I have one final thing to add, which is that Betsy sent a second message that's about who can't be served, and she said can't serve over 250 to 300% of federal poverty line. Sometimes that's too low a bar for the working poor who can't afford to hire a private attorney. Also can't lobby.
So Betsy is giving everyone here a fabulous tutorial on income eligibility for legal aid, which as she punctuates for us, really excludes a large swath of members of our communities who absolutely cannot afford legal counsel on their own. She notes that by virtue of LSC restrictions, these organizations also can't lobby a number of agencies that exert great control over families' lives, and that's a challenge to systems change. There's also bans on who they can sue when families have been wronged in very serious ways. So this is excellent. I am so grateful for those comments, and I just want to go back to double final jeopardy and compliment the calling out of a U visa as an example of a kind of humanitarian pathway to lawful immigration status that, yes, is an exception to the rule that LSC-funded organizations can't serve undocumented people. So I just think really, really incredible experience and thoughtfulness reflected in these comments, and it's really exciting to get to know you guys. Next slide, Kaylin. Okay, so Kaylin, I defer to you on what's going to be possible in terms of the poll here. True or false, people who can't afford an attorney have the right to be provided with one by the government. So I think, Kaylin, could we just give folks 10 seconds to enter into the chat quick yeses, trues or falses? And let's see, maybe you can say, gee, looks like half of them are this and half of them are that, or something like that.
All right, sounds good. I I looked quickly to see if we could add a poll, but I think just typing in true or false is a more efficient approach.
Yeah.
So we've got some coming in. I'll give it a minute here so people can find where they need to type and type it in. So far we've got 3 trues, 1 false, and 1 depends on what they need representation for, criminal or civil.
Oh my gosh, this is great. We hope there's more submissions, but Caitlin, let's keep it rolling. And I'm excited to that somebody is getting a virtual gold star. Whoever just typed in "it depends." So it depends on a lot of things. It depends on criminal justice versus civil law proceedings. But I think just let's sit for a moment. Let's just sit for a moment with this list. This list, which is a high-level list of when in one's life circumstances our country has made a commitment to providing legal counsel free of charge. Just look at what's on this list, including, by the way, if someone in your family or a healthcare facility believes that, perhaps one should be involuntarily committed to a mental health facility, okay, you'll get a lawyer then. But think about everything that's not on this list. Think about the white space. Myrna's fair housing needs are not on this list. Myrna's healthy housing barriers are not on this list. Myrna's immigration status needs are not on this list. And this raises really profound questions about equity and about justice, going back to some of the really powerful and disturbing statistics that Stephanie was sharing earlier, with which we are all familiar increasingly as we think about population health in parts of our, members of our communities who disproportionately are impacted by inequity and injustice. So next slide, Caitlin. So going back to someone's great chat comment before about, Samantha, thanks for inviting me to characterize legal services as a bottomless pit of resources, but that is not our experience. We have some really profound gaps. I mean, I think gaps is too polite. We have a gulf, we have a breach in access to legal support in our society. And this actually is having profound impacts in that invisible way, sort of behind the work that everyone's doing every day to advance family access to concrete supports when that's their goal. Next slide. So the question that Stephanie and I were posing in the paper and we're posing with you today, and we're going to keep posing until we get some satisfying answers and feel like you have more satisfying solutions, is what's in your toolbox? What is in the early childhood ecosystems toolbox to support families to tackle concrete support problem solving with all of the information and tools that they can possibly have? And knowledge of one's legal rights and remedies is an important tool, and so is being able to put that into practice, put it to use. One way that happens is through enforcement, right? Sometimes knowing it yourself is one thing, but then is there anybody out there who has the authority to take on that landlord who's discriminating? Next slide. So as we worked on the paper together, we spent a lot of time thinking about sort of historical associations with legal services, and also thinking about this gulf between family needs and the ability to access legal resources. And it provoked some thinking about, let's think about this through a public health lens, and that's part of Stephanie's background, and through a population health lens. A lot of folks and you know, if you're like me and you grew up on Law and Order reruns, what we're used to seeing are lots of depictions of the practice of law being about a person in court and a lawyer representing them in a very high stakes, acute legal context, right? And so a lot of our systems, for a lot of reasons, are geared in a very important direction, which is providing direct legal representation to individuals and households. But when we look through things through this population health lens and through a question of through a lens of perhaps expanding impact, it's an opportunity to re-examine, gee, if we can diffuse and disseminate more knowledge around people's legal risks, rights, and remedies in teams and organizations and systems, might we achieve some impact at the middle of the pyramid and some impact that actually has a preventive quality because more risks will be identified before they evolve into legal and health crises? And then actually, will some of that work have a deepening impact or a deeper impact because leveraging what is learned at a population health level through more equipped teams, organizations and systems partnering with families, can we actually start to inform in in more accelerated ways the kinds of system oversight and accountability that really are demanded by the needs of families right now? So we'll come back to this a little bit later when we talk about impact strategies. If you're thinking about legal partnering in your community, needless to say, most legal organizations don't have capacity across all levels of this impact pyramid for a range of reasons we've already discussed. Next slide, Kaylin. Thank you so much. So just to give you an example from MLPB's experience in Boston a few years back of how we attempted in one context to operate across those three different levels of impact. Stephanie noted earlier that in Myrna's case study, one of her children has sickle cell disease, and this means that her family is accorded certain kinds of civil rights-based legal protections, disability rights-based legal protections, actually. And so one remedy available to Myrna in terms of health and safety and finances was utility shutoff protection if she was living in the state of Massachusetts. And we had a really exciting experience of doing some work a number of years ago with individual families who were having difficulty getting shutoff protection that they were legally entitled to from utility companies, powerful utility companies, large, massive, bureaucratic, powerful utility companies that control their access. Sorting through some of those challenges, understanding the barriers better with families and with the pediatric teams that serve them, and then realizing, oh my gosh, one of the problems here is that these pediatrics clinics are really struggling with getting these requests for certifying a family's eligibility, certifying that Myrna's son has a qualifying diagnosis that renders the family eligible, because only an MD at the time could do that. So a lot of those letters weren't being written, despite best intentions and despite a lot of good faith. And that was really tanking a lot of families' shutoff protection chances. And that's their legal rights. So all of this work that we did actually wound up increasing by 300% in 1 year the number of letters that our pediatrics partners were executing on behalf of patients who were eligible for utility shutoff protection. And then we were able to go together, medical and legal together, to the state agency in charge of these processes to actually advocate for more consumer-friendly and frankly family-friendly policies that then were adopted. So I'm going to stop there and pass the baton to Stephanie, because she'll talk a little bit about a DULCE example of shifting things further down toward the base of the pyramid.
Thanks, Samantha. So what we've had the opportunity to do in DULCE is, because of the engagement of a multidisciplinary team where that legal partner is there reviewing cases that the DULCE team is seeing in a pediatric practice, and they're regularly using data to inform their program, they're able to notice trends in where where barriers are arising. And in one such case, in some of our California communities, they were able to see those trends and identify, because of the legal expertise at the table, the potential opportunities where maybe the system had responsibilities, or I'm sure there's more legal specific terms there, had responsibilities that they may not be upholding, and were able to place some phone calls to be able to inquire, ask, and in some cases even start to put through, potentially consider impact litigation. So these are the tools in the legal community's toolbox that might not exist when either a medical partner, a public health partner, or early childhood system partner places those calls. And by having that multidisciplinary team where the legal partner gets a view of what's happening on a pretty regular basis, it informs their practice, and while also providing opportunities for making population health impact. And it's been some pretty exciting opportunities that have happened through that very unique partnership.
Do you want to hit the next slide, Caitlin? I think it'll just amplify Stephanie's point. Yeah, and perhaps the next one as well. Great. Yeah, so we've talked a little bit about what is perhaps most familiar in our society when we think about legal partnering. We often think about court-based legal representation, which is so important. Of course, by the time a family gets to eviction court, there have been multiple interactions with highly stressful, if not re-traumatizing, kinds of experiences with power structures. And if there's anything we can do to actually interrupt that trajectory earlier, then we are promoting child and family health. Next, thank you. And so Stephanie and I spent some time just now talking about number 3 here. How do we get to more system oversight, law reform, and accountability? And this sort of middle of the pyramid, building capacity in teams and systems, really, to bring legal knowledge and insight to their problem-solving strategies with families. Boy, that sure seems like a secret sauce that we could use a lot more of. And it's something that we're paying, as Stephanie said, close attention to in the work of the DULCE National Learning Network. So, Caitlin, just know I've got my eye on the clock, and I know we want to leave a lot of time for these quite sophisticated colleagues to weigh in and share some of their community-based learning with us. So my goal is to move us through just really a few more points, and then Stephanie, if you agree, we'll turn it over to questions. And the deck's available. We're going to move right past MLPB. Go ahead, Caleb. Thank you so much. And when we think about this secret sauce, which MLPB has had the pleasure of spending time experimenting with and refining for almost a decade at this point, it really is multi-level and has several components described here. Several of those components relate to thinking through screening protocols with partners in care ecosystems to make sure that actually the way that screening protocols are designed and implemented actually elicit the kinds of information that will help to surface legal risks and needs. Continuous training and consultation as a core capacity building mechanism, and this, which enables the kind of issue spotting that several of you have shared in such great depth today, and then actually informing potential care delivery and partnering modifications that will be quite supportive of families. So again, you have the deck to spend more time with this, but just wanted to give you a little bit about what this actually looks like on the front lines. Next slide, Kaylin. So when we think about building capacity, we recognize that teams actually need to receive information about complexity in a very careful ways. And so one of the, when MLPB was thinking about what we do, the description that came to mind was really team-facing legal partnering. This is all in service of families and communities. But in order to keep pushing, steering us all closer to the base of the impact pyramid, we need to build the capacity of teams, organizations, and systems. And when we do that, we are actually operating as lawyers who are providing information to you in ways that you are relying on, separate and distinct from families. And it's one of the things that's been a real adventure and journey for us at MLPB, and I know also for folks who are doing other kinds of team-facing experiments, is that it requires being comfortable with being a generalist. And my sense of the early childhood ecosystem is that we embrace families as they are in all their complexity that they're navigating, and so generalism is a familiar idea, right? It would be awfully hard to be, perhaps effective if one said, I can only talk to you about X or Y or Z. But a lot of law, like medicine, is highly specialized. And so one of the things that's been really exciting about this work for us has been to despecialize and embrace more legal generalism. Next slide. You have examples of consultative support in the deck that Kaylin has already made accessible to you. So I'm not going to spend a lot of time on that there. Stephanie, is that okay with you if we keep moving? All right. Thanks. And Kaylin, go ahead. Why don't you share this example, Stephanie, from DULCE?
Sure. So this is from a legal partner who participates in a weekly case review that includes a family specialist. And they share, by participating in case review, I was able to spot a potential family with both parents may be eligible for naturalization. The family specialist will follow up and refer to the legal partner if appropriate. Before this, the family specialist was not looking for potential naturalization clients, and this allowed me to inform her about another type of service we can assist with. So this is a case where the early childhood workforce, the family specialist, her toolkit is being expanded with a whole set of understanding of potential legal rights and remedies with the backup of an attorney, so that she can really leverage and build on that trusting relationship she has with the family and share more information about their rights, and make those warm referrals to a legal partner if they're ready to address, and that's their priority, to address that need with them about their family.
That's great. And here we have, impact for a specific family and impact that will ripple to other families in that community through that newly equipped family specialist colleague. Next slide, Kaylin. If you're intrigued or curious and you're thinking about, gee, okay, this sounds like it could be promising for my toolbox, there's stuff to think about in terms of getting to know your local public interest law community. And so one is, just a few considerations here. Function over form. The public interest law community actually is comprised of a lot of different kinds of organizations, not enough. Setting aside that there aren't enough resources, the resources are diverse. It's not just about lawyers. There are tremendous teams of community organizers who in many communities are able to tackle some legal needs in professionally responsible ways. There are exciting access to justice innovations, including a Washington state-based innovation called legal technicians, who are licensed non-lawyers who are authorized to do certain kinds of legal work. So just know that the world of public interest law actually includes and transcends our amazing and valued colleagues in legal aid, some of whom I think we have on this call today. And it's really important to sort of take a global lens on one's public interest law community. Impact, we've talked about. You want to make sure that if you're sitting down with a potential legal partner, you're actually thinking about where you want to have impact on the pyramid, because it will provoke you to ask good questions about funding streams and capacity and specialization and generalism and all those things. Culture. Some of this, like I said, generalism, specialization, and doing stuff a little bit different than maybe it's been done before, that can be really organization specific. So something to think about, as is the role of data, which Stephanie mentioned. All of this work together across sectors is going to involve more data sharing, not less. So what's the culture of that? And finally, boundaries. There's really important stuff for all of us to think about as we come together more frequently to provide service, to be better partners to families, actually, to be better partners to families who we are mutually committed to. And in the spirit of innovation, it can be really terrific and common to blur a little bit of lines. As this work grows and we hope scales, we want to pay really close attention, especially given that so much of the early childhood ecosystem is comprised of mandated reporters, that we're really paying attention to conflicts of interest and times when, lawyers have to be thinking about, wait a second, I'm talking to this workforce member today, but I might be talking to mom tomorrow. And so what does that mean for who my fiduciary responsibilities tie to? We have some solutions around that maybe we'll have a chance to share another time, but just want to give you some of these considerations as you think about getting to know legal community colleagues in your neighborhood. Last slide, I think. If this is of interest, colleagues at the Children's Partnership in California did a great job writing up some case studies from their neck of the woods. You might find it inspiring and also thought-provoking in terms of your conversations with local colleagues. I'll stop there and just say thanks for listening and thanks for talking. Thanks, Stephanie and Kaylin, and happy to talk if we don't have all the time we need now, including after the webinar. Happy to talk after the webinar too.
Thank you so much, Samantha and Stephanie. We don't have any questions written in right now, so we're going to give a minute in case there was a question or comment that you wanted to share. You can add that in. I will put up our website information, so you can always enter, how to follow CSSP on Twitter, Facebook, or just going to our website. You can find the paper that Samantha and Stephanie referenced, which we will also make sure gets posted with the recording of the webinar. And reminder that you can download the slides already. You'll get a follow-up email with the link to the recording. And I'm not seeing any other questions come in, so I think we had some good discussion earlier on, and you covered a lot of great ground. So I think maybe we'll wrap it up. Thank you so much for this great work and for just helping to shine a light on the legal rights and remedies that can be relevant when we're wanting to support families. We got a thank you so much from Katie Haberman. So I know that
thank you, Katie.
Yes, thank you to everyone who was typing in and emailing and otherwise engaging in the conversation. We had a small but mighty group today, and I hope everybody stays safe out there. And we'll just keep doing these monthly webinars while lots of other meetings get switched to virtual. We'll still be here where we've always been, and look forward to talking to everybody again. Thank you all for joining us.
Thank you. Bye-bye.